I've been an athlete my whole life. I always trained hard. Even when I was practicing as a surgeon, I still got to the gym and trained and strong. And I was very competitive athlete. But I realized that my health was starting to go south in the fact that I was, just developing, diseases of what I thought were just normal aging, joint pain,
Yeah.
a little bit of, difficulty sleeping, probably some metabolic disease. So I said, well, I can't allow this to happen. I'm presumably a fairly smart guy. I'm a hardworking athlete. I should know better. So I went on this, sort of a journey of playing with my diet and nutrition. I'd never eaten junk. I wasn't like a junk food eater. I mean, I ate some, but that wasn't my focus. I always ate lots of protein, lots of, fruits and vegetables, more fruits and vegetables, to be honest. But so then I got in this journey where I was like, well, I remember at the time I was 40, I was 42, maybe 42, 43. And I was 285 pounds, and I wasn't fat. I was just a big, solid dude. Like, for instance, right now I'm about 250, right? So, I mean, I was 30 pounds heavier, but stronger. I'd won the Highland Games World Championships. It was
throwing. You're 6'5", so
6'5".
People know you're
I'm
a tall
6'5".
guy.
Yeah, I'm a big tall guy. I've always been a big guy. And so I was about 285, and I said, you know what? I'm done being this big. So I dropped down. In 3 months, I dropped down to 230. I mean, it was low-fat diet, high-fiber diet. I was getting up at 4 o'clock in the morning, a couple thousand jump ropes in, go to my work, go to my clinic. If I had clinic, I go on my lunch hour. We had a little gym attached to the hospital. I'd run over there, get a workout, come home, put my kids to bed, another couple thousand jump ropes. I did that for about 3 months solid. Lost weight, was lean, and I was so friggin' miserable. Man, I was just like, I can't friggin' do it. I mean, the nurses are like, man, we like the fat Dr. Baker a lot. Man. You're kind of an asshole, dude. I mean, because I was like, I was like, this, I can't do that. I can't live this way, right? So then this is, like I said, this is like 2012 or something like that. And I was like, maybe earlier than that, maybe 2011. I was like, okay, so now I'm going to do this Paleolithic diet, which was popular at the time.
Yeah.
Did that for a while, got into low carb, started reading some books on nutrition, started to kind of adopt a more low carb approach, a ketogenic approach. And then in like 2015, I discovered these friggin' wacko weirdo people eating just nothing but meat online. I was like, what the hell are these people up to?
Right.
It sounds nuts. I mean, it was like,
sounds nuts, right?
Nuts. It sounded nuts to me. And I was like, but I was morbidly curious because they were making some pretty significant and what I thought were somewhat kind of unusual or outrageous claims, getting all this health going, MS resolving or rheumatoid arthritis going away, stuff like that. It was enough to pique my curiosity. And I read